We are all aware that paralysis, once it sets in, takes a long time to recover, and in many patients, the recovery could be incomplete also. But today I'm going to talk about something in which the recovery is complete, and if the patient is treated on time, almost all the patients recover. So I'm going to talk about something called as Bell's palsy, or a type of facial paralysis. Now, Bell's palsy usually occurs in young patients. It can also occur in older patients, especially with diabetes, and even pregnant females are not spared by Bell's palsy. As such, a definitive cause has not been identified, but yes, we found an association with certain viral infections. So usually there is a history of upper respiratory tract infection in these patients a week or so prior to the onset of the facial palsy. The patients obviously present with what? They would present with asymmetry of the face. So they would find that one side of the face is drooping down. So what happens is the one which is functioning, the side which is functioning, starts pulling the face onto the other side. There would be drooling of saliva from the affected side, so patient finds it difficult to eat food. The eyes obviously do not close completely, so then it leads to redness and other problems associated with the eyes. There could be some variation in the taste also. So these are the typical symptoms that patient present to us with. But most importantly, the cosmetic deformity that it creates, that leads to them presenting to us usually very early on. So what happens is the facial nerve gets swollen because of the infection or some unknown cause, and since it passes through a very narrow facial canal over here, the tightness of the canal and the swelling leads to paralysis of that nerve. The good thing is if it is treated on time, and the treatment usually consists of steroids. So if steroids are given and the inflammation subsides quickly, the facial function recovers completely. So the key over here would be presenting to your doctor on time. Apart from that, there is a definitive role of physiotherapy also in this. So when the facial paralysis onset has happened, what is happening is the muscles are not functioning anymore. So what the physiotherapist does is keeps the muscle artificially active. So once the function returns, the muscle is already fired up and is ready for action, and the recovery is that much quicker. Another important thing that we have to realize is the fact that it affects eye closure. The facial nerve is responsible for allowing our eyelids to come together. So the eyelids tend to remain open if there is facial paralysis. What that leads to is something called as exposure keratitis, where the corneal layer, because of excessive drying up, lack of tears, start getting inflamed, and it leads to an irreversible change in the cornea. So what can be done for that? So what we do is we preempt that possibility. So we protect the eye. If the patient is moving outside, it's always better to move out with a protective eye gear. Why the protective eye gear? Should it be black as such? No, I would say even a transparent one would do, but it has to be protected completely, because imagine there is a whiff of wind and some dust is blown into the eye. This eye would close on time, but this eye would not be able to close, leaving it open for traumatic injury to the cornea. So it is important to use that protective eye gear. That's one thing. Apart from that, there is excessive drying up of the eyes. So we use artificial tears on a regular basis to keep the eyes moist. And finally, when the patient sleeps, again, there is a possibility that the eyelids would be kept open, and if it's kept open for 10 hours, then it could lead to problems. So what we need to do is, again, patch up the eye when the patient is going to sleep, so that the eye is protected in the sleep also. What we are achieving with this is preventing any injury to the eye when the nerve function is returning. When the nerve function returns, everything comes back to normal. But in the meantime, if there is injury to the eye, then you are stuck with that. And then again, there is another round of visiting ophthalmologists and other doctors to set that thing right. So this is more of a preventive and extremely important thing that I've realized in my practice. Eye care. Now the question arises, can it be due to something else? Yes, very rarely it could be something more ominous also. Something like a parotid gland tumor. So we obviously have to examine the patient. So the facial nerve gets trapped in this tumor and you develop the same kind of features. It could also be because of an intracranial pathology in very rare cases. So for that, what do we have to do is keep a low threshold for imaging. So if we find that the patient is not improving with the treatment, or if the deterioration continues despite treatment, then it does make sense to get an MRI done. So MRI is not needed in all the patients, but yes, in this particular condition where the recovery is not happening, it's better to scan the patient and see what's happening inside. So the take-home message over here would be, go to the doctor on time if you see an asymmetry of the face. That's one. Second would be, Bell's palsy, if treated on time, in most patients is completely curable. Eye care is extremely important. Physiotherapy forms a large part of the treatment of this illness. And finally, even if there is a small deficit or something bothersome, it can be usually taken care of later if required. So on this note, it's not just about Bell's palsy, it's about jingle bells also. Merry Christmas to all of you and a Happy New Year, and hopefully it's going to be one really prosperous new year for all of us. Thank you so much. Take care.